Hello, everybody. This is Gary. Today is Friday, June 26, 2020. It is 7:06 p.m. Eastern Standard Time in the United States in Rochester, New York. This is my coping with schizophrenia vlog entry for today. I have spent the past 2 days in the psychiatric emergency room at the University of Rochester Strong Memorial Hospital. I was having bad symptoms of paranoia, hallucinations, delusions, anxiety. Um, I wasn't feeling very well at all. My body was physically shaking. I was terrified of everything that was going on through my head. So I called the police and the ambulance, and they came and did a mental hygiene arrest, which is not a criminal charge arrest. It was just because that I called and I told them that I was suicidal. They took me to the hospital and kept me there for observation for 2 days in what's called EOB, emergency observation beds. I was not actually admitted into the inpatient psychiatric unit, but I wasn't officially just in the emergency department either. I was sort of like in between being under observation. And they said that I was able to go home today because I was honest with them. I was not suicidal. I'm certainly not violent. And I understand why they kept me there. Even though I'm the one who called the ambulance, um, they said that I couldn't leave for at least a couple of days. And so I stayed there for a couple of days. I'm feeling a lot better. They administered medications to me like Klonopin, um, which they renewed the prescription for. Um, if I had a little bit more Klonopin, I might have been able to avoid going to the psychiatric emergency room, but I have to use it more sparingly. They did give me another 6 tablets, half milligram apiece, to last over the next 2 weeks. I have an appointment with my psychiatrist on the second, I believe, on the telephone. It's going to be a telephone home visit, not a face-to-face visit. And I have another appointment with my psychiatrist, a different psychiatrist, I believe on the 30th of June. She's the supervising psychiatrist, so I'm going to be speaking to her just about what's going to be going on with my treatment because I have a new psychiatrist, which is the appointment I just mentioned on the 2nd of July. Um, so I'm trying to coordinate everything as best as I can with my treatment, staying out of the hospital, sticking to my medication regimen, sticking to my daily schedule. When I came home today, first thing I did was I started doing some work online, which is I do consumer surveys for extra money, and I wanted to get back to my schedule as much as possible. But most of this day was just spent at the hospital getting ready to be discharged, so I didn't do a lot today for my regular schedule. I thought I'd go ahead and make this video and let everybody know how I was doing. I think I'm doing a lot better. I feel a lot better. Still some anxiety, some nervousness. Um, I'm still smoking heavily. I haven't quit yet, which I want to quit because I'm chain smoking. I have nicotine patches for the next 8 weeks, so I have to set a quit date and try to quit smoking. Smoking is a big danger because of the COVID-19 crisis. Smoking weakens the lungs, the respiratory system, the heart. If I got coronavirus, I would be susceptible to severe complications because I smoke. They did give me a COVID-19 test at the hospital, the second one I've had in a couple of months, and it came back negative as not being infected, but that's not 100% sure. Um, I'm glad the test came back uh, negative. So as far as I know, I don't have coronavirus, but I'm using hand sanitizers. I wear a mask when I'm out in public. I wash my hands a lot, which everybody should be doing. Wearing a mask shouldn't be a political issue. You should be doing it to protect yourself and, more importantly, protecting others. Because if you're younger than me, I'm 54. If you're in your 20s or your 30s and you're not wearing a mask, you may not get sick even if you get infected, but you may be spreading the virus to other people. And so wearing a mask is important so you don't spread the virus to other people. Um, One of the things I notice with me is that since I'm a heavy smoker, I cough a lot. Not necessarily because I have an infection of any kind, but just because I'm a smoker, and that can send droplets out of my mouth into other people. And if I was infected and I didn't know it, which is possible even when my test came back negative, I could be infecting other people. So whenever I go outside, I do wear a mask, and my cough is pretty heavy because of my smoking. So I'm just doing the best I can, trying to cope the possibility of COVID-19 infection and trying to prevent its spread and trying to stay indoors. But at the same time, I need to get outdoors to exercise and feel normal. And whenever I do go outside, I wear a mask. There's not much else to report on. I'm just going to do the best I can over the weekend, and I'll keep making these videos as much as I can. Comment, like, share, subscribe, press the notification bell so you know when I put out new videos. If you have a topic you want me to cover in my videos, whether it's about mental health or something else, put it in the comment section. And if you really want to help out my channel, share my video on Facebook and Twitter and other social media. I appreciate your help. Take care.